Now, protests like that one are happening right across the country. Toronto saw a similar gathering on Saturday. Joining me now is Dr. Raywat Deonandan, epidemiologist and associate professor at the University of Ottawa's Faculty of Health Sciences. Dr. Deonandan, the demonstrations aren't only harmful to the health of those who are actually in attendance, but they can also have an impact on public health.
Yeah, it's not great. Now, they're outside, which is nice. It means ventilation is good, but they're clustered together, which means the probability of transmission, if any one of them is infected, is quite high. And we know from the Trump rallies that that kind of gathering can be a super spreader event. I mean, it might not be, maybe we got lucky, but it could be. And they can take this disease home to their parents or their grandparents and spread it throughout their community. So these are poorly advised gatherings that may accelerate the pandemic if things go against us.
Well, health officials in Ontario advised this morning that the traditional trick-or-treating shouldn't go ahead in hotspots like Toronto and Ottawa, but Quebec is allowing it to go ahead. So what is the right answer in this?
Well, the right answer is to err on the side of caution and to ask ourselves, why do we have Halloween? Is it to get candy from strangers, or is it to dress up and to be social in your community? I think we can get 95% of Halloween without having to go door to door and interact with strangers and potentially expose ourselves to infection. So the right answer, I think, is to not trick or treat, but to get dressed up, to walk around your neighborhood and to enjoy the spookiness without exposing yourself to a disease.
Well, it is obviously getting cold out there, and that means people will be spending a lot more time inside their homes. So how do you see the next, let's say, 4 to 6 weeks playing out?
Well, as it gets cold, as you said, people will be indoors more. If you're indoors with your family, your bubble, that's fine. But if you're going to be socializing in other people's houses and exposing yourself to people you don't usually interact with, that gets more dangerous because the probability of transmission increases. And, you know, with the bars and restaurants closed in some parts of the province, that's going to help a little bit because we can't gather there. So I hope people are being circumspect and not going to houses they do not usually go to.
So you talked about some of those closures now. Of course, York Region is joining Toronto, Peel, and Ottawa. Should there be additional measures considered for hotspots?
I'm loath to recommend additional restrictions. I think we should see how these ones pan out. And I think if everyone is responsible, if we don't go to anti-mask rallies, if we wear our masks, if we keep our distance, if we don't go to other people's houses, we don't have to close things. So this is entirely incumbent in the hands of citizens to behave appropriately and to avoid economic closures.
Well, I know there's an antibody study happening in Texas right now that's keeping people sick with COVID-19 out of hospital.
It's fantastic. I love this, and I'm quite bullish on the potential for monoclonal antibodies to be a great bridge between therapeutics and vaccines. In fact, the very first Nobel Prize in medicine was given to someone who gave external antibodies to a diphtheria patient. And we've had this technology for 30 years for cancer and inflammation. So it's for people who are struggling with the disease to prevent them from dying and from being hospitalized in the first place. So the danger, of course, is that side effects are a real thing with this therapy, but I'm quite excited to see how this pans out.
All right. Well, thank you so much. Always an interesting discussion, Dr. Deonandan, joining us today.
Thank you.